And we're back. Okay, so I was just watching you guys, and clearly, Paige Wilson, thank you, Paige, was a huge hit. You guys are like, wait, toilet paper rolls? Toilet paper rolls? I can do that, which, let me just remind you, there's some of us who can't. We're just bad all the way around. You put a couple of boxes in front of me, and I'll just wind up crying. So I have props to everybody who is going to go try those great holiday crafts and give your cat a merry little Catmas. So thank you again, Paige Wilson. That was really fantastic. Reminder to everybody, you can win Bob's from Skechers shoes and a lot of other great gifts. All you got to do is take a picture of you with a cat, you know, holiday sweater doesn't hurt, your cat watching Cat Camp, because all cats should be watching Cat Camp. And all you gotta do is tag at Cat Camp USA on social and use the hashtag Petco Foundation to be eligible for all those great prizes. So, and a reminder also, don't forget to shop at catcamp.com. Lots of great new merch, cool beanies, sweatshirts, t-shirts, also some great deals on my toys, other cat toys, masks, mask chains, and so much fun stuff. And speaking of fun stuff, you guys, it's time for something a lot of fun. I think, somebody remind me where we're going right now? Yeah, okay, so because it's fun, life with seniors can be fun, and life with Ellen is always fun. Ellen Ellen Carozza you are AKA the cat LVT. You've been in veterinary medicine for over 26 years, concentrating on cats for a good chunk of that. You have done a lot in terms of creating programs and protocols for cats and seniors. And hello, Ellen. Good to see you again.
Hi, thanks for having me. I always enjoy working with you guys.
Okay,
Cat Camp is one of my favorites.
Can I just see a little bit more of your sweater? I want to see your sweater.
Oh, hang on a second. Is this Christmassy and gaudy enough for everybody?
Well, it's penguins, but yes.
I couldn't find a cat sweater like that. That Amazon
like
Prime
this?
could send me in time.
Like
I
this?
couldn't get one. Yeah. Jealous. Well, and it's a white cat too. Jealous.
Yeah. Just saying, maybe I'll give it to you, because I don't know when this is ever going to be worn again. In the meantime, you guys, we're back, and what Ellen and I are going to talk about now, because as you may or may not be aware of, we have gone through the kitten years, we've gone through prime time. Now we are into the senior years, the double digits and beyond. And as we've been talking about all day long, we're going to be talking about your cats living their best lives. And here's where I want to start. Your cats are going to get older. Let's just let that sink in for a second. Cats get older. And I think, and Ellen, I'm sure you'd agree with me, that part of the issues that we wind up dealing with is the human side, because we start to get a little, as my people would say, verklempt about our cats getting older. And I think we start to go into that place of just panicking about it. And of course, that doesn't do any favors for the cats themselves. I'm sure you see plenty of that.
Yeah, you do. And, you know, we're all guilty of putting our own personal emotions on animals. You know, they live their own lifespans. They can't live ours. And that's something that we actually have to learn to accept. A lot of people don't want to accept that, but, you know, they age so much faster than we do. So, of course, their lifespan is going to be a whisper compared to ours. And then once you realize that you can maximize that small amount of time that you're going to have, those years are going to feel like they're going to be by broader in the standards, that you're going to actually have to create more memories with these guys. But you do have to realize that, you know, 20 years, I mean, that's a good chunk of time for a cat.
Yeah, I mean, we hear a lot of people go, wait a minute, my cat's 8, he's 9, is he old? You know what I mean? Is he going to die? You know, we're getting into that weird place. And I think that what you and I are going to dive into in a bit is how we can create vitality, how we can not just talk about survival through the double digits, but vital cats. And before we do that, I just have to, because he's getting squirmy. Can you bring over my boy? Because this will go somewhere, and this is weird that I would be bringing him in right now. But this right here is, you know, his name at the moment is Thor, but I think I kind of want to. He's my foster kitten. He is at this point, I think he's 4.5 months old, somewhere in that area, and he is just a little. But here's the thing about him, other than the fact that he's like, whoa, where are we? But his name, I think, will become Valentino if I have anything to do with it. But anyway, he is the spitting image of my seniorest cat that I ever had the pleasure of sharing my life with, Valoria. And I wanted to just sort of segue into that about super seniors, because I think a lot of people who know me knew Valoria and knew the whole story. And okay, Thor. Uh-oh. No, Thor, it's a big high table. Anyway, Thor's gonna live his best life. Off on a table. But anyway, here's a picture of Valoria with me on the cover of my book, Total Cat Mojo, available everywhere. No, anyway, this is when she was older. When she finally passed, she was 26. And she was with me for almost half my life. Crazy when you think about that, right? But a lot of people would ask me, you know, is that the normal lifespan of a cat? Can I expect that? How do I do it, et cetera? And I would say, you know, it's always kind of a difficult question because it's not really to be expected, you know. And you've had super seniors in your life, haven't you, Ellen?
Yeah, I've had two. I grew up with, both of them were bottle babies of ours, believe it or not. One was named Baby, which should give you any indication on how she behaved at the vet's office. Anybody named Baby, you're asking for it. And then I also had Goblin, who was one of my little tiny kittens that I hand raised from, you know, moment one. I mean, she came in a shoebox, half eaten by her mom, and we managed to kind of recoup her. And I had her till she was 21, till she passed from bladder cancer. But like, did I know they were going to live into their super seniors? No. Do I know the secret of what I did right? No. You know, so there's all these things you have to consider. But man, I thought it was awesome having like a super senior in my life.
Yeah, and I mean, listen, I don't think we're immune to the fact as they get to that super senior level where we start going, you know, you worry, I think, a little more than you would before, because they do become a little more fragile. But I do love the fact that people come to me and they're like, so what did you do? What did you do to make her live that long? You guys, I had nothing to do with that. I mean, not nothing, but I was blessed to have her in my life. And obviously, we're going to talk about vet care in just a second, obviously being proactive about her vet care, and helped. Diet, of course, helped. Keeping her vital through exercise helped. We're going to get to all of that. I just thought it was so weird that I have this short-term foster kitten right now, and he is literally the spitting image of her. So it brought back a little bit of, you know, I guess it's normal to be a little sad about that, but also this weird, I don't know how to explain it. It just, but even, anyway. So anyway, Ellen, I'm going to take off my glasses now because I have so many copious notes. I've been reading through a lot of your material, and I want to make sure that we can talk about the things that we want to talk about. But I think that the connecting thing here is about, you know, we're not just here to have your double-digit seniors just survive. It's about vitality. And I think there's a lot that we can talk about that'll get us there. Now, I think the first place I want to start is one of the facts that I actually found looking at your material, and I didn't know. And it is fascinating because, and we'll get into it and why it's so fascinating, but you said that 99% of cats over the age of 12 have arthritis.
Yeah, some cats, by the time they're 12 years old, you are going to have arthritis that you can physically see on x-ray, all right? By the time they're 3 years old, some cats are already showing signs of arthritic changes. So by the time they're in their seniors, they are actually having arthritic changes that you can physically notice on them. And we go ahead and we do those x-rays, and it's visibly apparent that we're just, you know, it could be minute changes, but it could be changes enough that the client's like, oh, you know, she's not getting up as easy as they normally can. They're having trouble jumping up on the couch. having trouble squatting when they're using the potty box, like all those subtle changes. And man, if you have arthritis yourself and you go ahead and look at some of these seniors x-rays, you'd be like, oh man, Kitty, I feel for you, because you know they're uncomfortable even by seeing it. But yeah, by the time they're 12, 99% of cats are going to have arthritic changes.
And it's funny that you say that, because the difference between humans and cats when it comes to arthritis is that humans are like, "Ay, my back."
Yeah, we like to complain.
Yeah, I know. You get out of bed, you're like, "Oh God, it must be the weather, barometric changes." But with the cats, because of who they are, and we think about who I call the raw cat, the cat out in the wild, it would be a death sentence for them to show weakness, to show that they're not feeling well. So they are incredibly stoic about pain, which is why, and I was talking about this the other day, that there was, when I was coming up back in the 90s, we were all going up, we were all amazed, because there was a study that came from a vet teaching hospital that showed that 70% of cats over the age of 2, because we never knew to look for it proactively. They hid it so well, you know? So I think it's amazing that you see that much arthritis. So that said, let's take arthritis as sort of one of those diving boards to get into the deep water of seniors, and talk about not just diagnosing, but preventative and what to do once it's diagnosed, both behavioral and physical. So I'll start with you. Take it away. Tell me something, pretty much everything.
Oh, pretty much everything. Okay, so like when you're actually noticing about, like if we're talking about arthritis in cats, there are the subtle changes that you are going to notice. You may notice some changes in your cat, which we like to call sarcopenia, as they get older, that they're naturally going to start losing weight and losing muscle mass, and as well as body fat, which, you know, you need that tissue to hold the skeleton up, right? So now the animal becomes a little bit weak in those areas. They might have trouble squatting. They might actually have a hunched appearance as they're walking because their back hurts. A lot of cats will develop arthritis in their elbows. A lot of declawed cats will develop arthritis even earlier. And so then you have this referred type of arthritic changes simply because they're walking on their feet differently.
Right.
The cool thing about veterinary medicine is, in the past 5 years, there has been the feline grimace scale and the feline pain scale that has come out, right? With the, you can use their face and their body language by telling you how uncomfortable they are. So we've actually evolved quite a bit in medicine for us to even just look at the patient at home and say, if you're noticing your cat looking like this, and we notice your cats have these physical changes, you can be more adept as an owner to noticing that your cat is in some sort of discomfort that we need to address, whether or not it's on the medical standpoint, or can you supplement at home as well?
Wow. I told you that no matter what you said, I wouldn't know it. So that's really amazing though, that scale is out there, because I really think, and again, you guys, this is, if we're able to help with anything over the course of this day, it's also being able to look at your cat family in a different light, and to be able to see things for what they are and not what you fear them to be or hope they won't be or whatever, but having this sort of objective sort of scale, I think is amazing.
Right.
And that helps to keep, so if somebody calls you and starts to say, I think my cat's going through something like this, you would be able to ask them, are you seeing what? Can you give me an example of what you'd be asking them?
Well, normally when you have someone that calls up and they say, you know, I'm noticing like my cat's howling at night, or it's acting lost, or, you know, it's doing a whole bunch of things. You know, when they call the clinic and you have to go through the, well, I really do think you need to see the doctor. Let's get you in to make sure there's something physically not going wrong with the pet. But at the same time, what you can do, and it's public access, is we send them that grimace scale and the facial pain scoring scale, so they can say, yeah, my cat's really uncomfortable. I need to get in sooner rather than later. But you know, you're going to notice a lot of changes. You're going to be like, are they able to go to the bathroom? Can they eat and drink? Do they seem in significant discomfort? Can your cat actually curl up into a ball to sleep, or is it only able to loaf? I mean, these are all of the subtle signs that we know this cat is not feeling well and something needs to be addressed. When they're actually not sleeping comfortably, like they're in that nice little C curve that look like a little croissant, we know those cats probably have some sort of major arthritic changes that they can't even sleep comfortably. So when they say, I've noticed things are off with my cat, including grooming, arthritic cats, a lot of them will not groom properly. And that's usually the first thing we notice. We're like, that cat doesn't look right. Oh yeah, he hasn't groomed in 6 weeks.
Right.
Something's
And
wrong.
mats, we'll see mats because they're not grooming. All of a sudden we'll see
Right.
mats, and see dander accumulation, greasiness, and that kind of thing. Again, these are, it's great. We're talking about things that you can look for and say, okay, I think, you know, partially this is what my cat is going through. So then the next step becomes, what can we do for them? And
Right.
both from an at-home perspective and from a clinical perspective. So let's just start with the at-home stuff, because there's some things that, the one thing that I didn't think about, and obviously you guys know Ellen and I have talked before, but one thing I didn't think about was the height of their bowl, and how a cat with arthritis might avoid eating just because of that. Can you go into that a little bit?
Yeah. So when we have arthritic changes, a lot of people just always think it's mid back and lower back. Well, when you have cats that have elbow arthritis, they have shoulder arthritis, they can have cervical vertebrae arthritis, bringing the bowl up for them to eat so they can just dip their head down to make it a lot easier is probably going to be able to enhance their quality of life right there, because it's more comfortable. And that's when we lower the back half, because we know they're probably going to have problems squatting to use the litter box. So we need to make sure they have lower access so they don't have to work as hard to step over items. So we want to make sure what we're doing is meeting their physical needs, just like by making subtle changes. It's nothing major in the house. These are very subtle changes that we can do to enhance the quality of their senior years as they're starting to age.
Yeah, I mean, one of the things that I've found that has worked so well for seniors is switching to a puppy litter box. And puppy litter boxes are big, but they also have as close as we're going to get to a non-existent lip at the front. Yeah, are you going to have a little more litter kicked out? You know what? Okay, that falls under the category of deal with it, because you have a senior. But the thing is, with them, they can just walk in and walk out. And I think that's just so important. One other note I would give on that one is, another thing that you can look for is, especially, and again, this is just my experience, especially when it comes to pooping out of the box for cats like that, one thing to look at is the height of litter that you have in the box. Because in order for them to get into the position of poop, then they've got to grab on. There's a little bit of grab that happens, and it's a totally different body position. And if they've got to get into that litter too much, just experiment. And when I say experiment, by the way, guys, I don't mean do a real sudden change in an existing box. I mean, add one, and then you have an experiment going on. So if you're going to bring in a puppy litter box, you bring another box in, you put it in around the same location as their most used box, and then see what happens. And so that's just a couple of things that can happen. But yeah, I love that idea of like meeting in the middle. We raise the bowl, you know, we lower the side of the box. We just allow them to be as close to center as we can. I mean, and obviously there's tons of reasons why a senior would maybe stop getting into the box, but that seems, arthritis is one of those things I guess we just don't really think about.
Yeah,
And
because
also,
everybody thinks that arthritis is no big deal. It is a big deal when you're an animal that depends upon all their weight on all four limbs.
And I was just about to say, we should spend a minute talking about seniors who have been declawed, because that brings arthritis to a whole different level. So for you guys, you know, and believe me, we know there's a lot, and I know we're going to see it in the chat about declaw. Everybody gets it. I think at this point, the declawing is a very bad thing and should not be done to any cat. But that said, once it's been done, we are taking their digitigrades. They walk on their toes. And when we change that by a declaw, everything gets thrown off. So we're going to see a lot more changes. Are there certain arthritis symptoms that you see a lot more of in declawed cats?
Well, we see they're much more crankier when they come visit us. Number one, they tend to be the more of the quote unquote problematic patient that comes into the clinic, simply because they're in a lot of pain. and unfortunately, when you work feline only, you are blessed with second and third hand cats from other clinics that they have given up on. And by the time we get our hands on them, the majority of them are declawed, and we can understand why that they hurt. Um, so that brings in the aspect that we notice that they have more elbow arthritis. They're more reluctant to walk. They tend to be obese because the people bring the food to them, and that doesn't help the situation either.
That's a
So now you're
great
putting
point.
on more weight on digits that can't even support the weight to begin with. So why are we doing this to them? So it's important that we keep those cats that are declawed at a healthy body weight so we can minimize the gravity on those toes already.
Right.
And that's one thing that
And
we don't think
arthritis,
about.
that I mean they can get, so let's sort of shoot down the list of where we're most likely to see arthritis in cats. I know this is it might seem kind of obvious, but with declawed cats, we're going to see arthritis in their toes, right? I mean,
Yeah.
you'll see it there.
Yeah, they're pretty ugly on X-ray.
Because
They look
actually
like this. They're awful.
they get gnarled, right? And then as we go to elbow to shoulder, um, spine, hips,
Yeah.
knees. Do you see them?
You can, especially in the cats that are all four declaws. But then again, when they're actually shifting their body weight, so they're going to try to keep the weight off of those front feet as much as possible. So now you're going to see more spinal spondylosis, more stress on the hips, more stress on the on the knees. Sorry. So you're going to see all the stress happen there. But you can have cats that are prone to more severe arthritic changes versus just some subtle changes that you'll see. I mean, there's some cats that we look at the x-rays, we're like, oh my God, kitty, how can you even move, like even actually flex your joints? Sometimes the arthritis is so bad. So it really depends upon the cat and their genetics on how bad their arthritis is going to get. But pretty much guaranteed, those declawed cats, a lot of it is that referred pain that's just not joint pain, but it's also muscle pain as well, because you can't support the body the right way. So you have to think of treating the cat in a broader spectrum, not just trying to localize and pinpoint the source of pain as well. You have to treat everything in order to make them feel better.
So let's talk about that for a second, because as we're talking about vitality, we don't want to just give you guys a laundry list of all the things that happen. We just want you to be able to observe these things. But how do we get through it? And you were just talking about treating the whole, the whole cat. So recommendations so that we can, and then I'll jump in and talk about sort of specific things that you can do just to keep your cat going in terms of their raw cat mentality, their mojo. But in terms of just getting them to the point where they can be their best selves, whether it's pain management, whether it's joint sort of lubing, what is the kind of thing that when you start talking about the whole that you're talking about?
Right. So that's basically what it is. Do we have to treat the pain with actual like opiates, non-steroidals, if their kidneys can handle it? Do they need any kind of neuropathy pain drugs to kind of help with that neuropathy pain, especially in those declawed cats will have that neuropathy pain with their feet? And joint supplements are a big one. And a lot of people don't give joint supplements a big enough chance. In all honesty, they go through the one little bag of chews and they're like, I didn't see a difference. And then they throw it away and they don't supplement anymore. And they just want more of a Band-Aid medication from their vet. Well, you are going to see better changes and a higher quality of life when you go the multimodal route for treating their pain. And you don't always have to do oral medications. That you can do laser therapy. You can do TPEM therapy with the Assisi loop. You can do acupuncture. You can do massage therapy. There are other adjuvant therapies out there other than just medicating these cats and supplementing
God, I love
them.
the term multimodal, man. Let's just sink into that for just a second. Multimodal. I mean, obviously, you heard what Owen just said, that we're talking about, because we tend to do that. I think we were just, and I'm guilty of this. If something hurts, I grab a Tylenol. I do whatever it is to make it go away. But there are things that we can do for pain. You did mention very quickly the Assisi loop, which I really, what have you seen with that? If you guys don't know, if you can explain the loop and really quickly and say what it does.
It's TPEM therapy. It works on, if everybody knows about the cold laser therapy for animals. It works on a very similar route. It actually activates like the mitochondria of the cells, makes them do their job, helps reduce swelling, increases circulation, allows the body to heal itself. But a lot of it is to help decrease the inflammation on the cellular level. And I'll admit, I own a lot of Assisi products. I have like 3 mats and like several loops. I'm a big believer in them for all life stages, not just the senior animal. But I've personally seen a major difference, especially when using one on Egbert. It was really important for him to have that type of therapy every single day, other than rehabilitation for moving. We got to keep the body moving, because when you're arthritic and you don't feel good and everything aches, well, sometimes just simply learning to move again and moving correctly makes a big difference for these guys. So while we're actually treating them for that inflammatory response, we actually have to kind of keep those tissues moving as well so they don't atrophy more.
I mean, when you think about it, it's a little bit of a, where are we going to go here? Because you don't want to get your cat to a place where they're consistently kind of dopey, because then how are you going to keep them moving? And it's something that I want to get into for a second, but the idea that we can keep them moving, and like you said, it's multimodal, depending on where they are. But I also, people ask me about Valoria. Man, she was glued to that loop for the last couple of years of her life. And by the way, it's funny. I mean, I put out a video a couple of weeks ago about seniors recommending multimodals, and I went into a couple things. I mentioned acupuncture, and kaboom, I get all this like pseudoscience. I get it.
Yes.
There's some things, but I will tell you right now that Valoria would not have lived to 23, let alone 26, without acupuncture, because it wasn't her kidneys, her liver, her internal organs that broke down. It was her joints, and it kept her going, and the loop, and like you said, supplements, lots of things that you guys can give in conjunction. And we're gonna loop back around. Get it? We're gonna loop back around to something else.
CC loop it.
And we're gonna CC loop back around in a second. But I did want to say, in terms of the vitality of keeping your cats moving around, all I can say is this. So when it comes to play, it does mean, we talked about playtime with kittens and with prime timers. When it comes to the double digits, a lot of time you got to bring them out into Muhammad a little bit. You've got to be able to get them to just engage. And whether sometimes passive engagement is still engagement when it comes to the raw cat, as long as they're reaching up and going for something, they're not going to run around half the time,
Right. So I think it's important that you've brought that up as well with the vitality. Is one thing that everybody forgets, is not that you're just bringing the enrichment to them, you're actually enriching up here as well.
Exactly. Because as we talk about, like you're saying, we're talking about the whole. And with cats, they are whole. The mind and the body are just so at all times actively engaged. And for a cat to feel vital, they got to be hooked into their raw cat, to their hunter, to that feeling of, I know what I'm on this planet to do. So in a way, look, there are a couple of suggestions I would make for the seniors when it comes to that movement is, number one, think about toys that are like that. Puzzle toys are a great way to get them going. And if they can't really move around too much, you can still go for those play stations where they have to dig something out. They don't have to chase anything. They just have to go for it. The other thing is with interactive toys, it's okay if they just follow you. They don't have to jump. They don't have to do, well, they won't anyway, but just moving and engaging and getting those joints, having some natural lubrication to them. And the last thing I'll say about it is in terms of environmental enrichment, or catification, as I call it. It's all you want to do. Your cats still want to get up in the window. They still want to hang out in the sunshine. They still want to be able to look at the birds and the traffic and the people and everything out there. We have to just think about adapting. That's all. Instead of having them jump up, let's have a ramp for them and make it adapted to their ability to walk upwards. But don't give up on them. Don't give up on the vertical world just because they're getting older, And then you can still also enrich the lower part of the world as well. All we have to do is adapt a little bit. So I just wanted to go off on that spiel there. I'm sorry about that.
It's
So
an important spiel to say. I mean, a lot of people don't think about that. They think as you age, this older cat, all it wants to do is sleep all day. That's not true. You're not giving them the opportunity to interact anymore. You're just letting them, you know, go to sleep in a corner because you are afraid to actually have them interact with the world around them. They're not these fragile little creatures. We're making them
yes.
into fragile little creatures because we're allowing them to just sit in atrophy for the rest of their lives.
You go. That's exactly right. That's exactly right. And again, this circles back to the very beginning, guys, when we were talking about the fact that cats get old, but that doesn't mean that we have to treat them like Crystal. I always butcher this quote, but aging itself is not a disease.
No, it's not. Getting old is not a disease. Age is not a disease at all. And that's why when we have these cats that come to the vet, like I had a 19-year-old the other day have his teeth cleaned. They were afraid of doing it. Yeah, 19 is 19, whatever, but the vet cleared him because he's healthy otherwise. Let's do it. Let's enhance the quality of his life. He has gross teeth. Let's fix this problem. We're going to enhance this quality of life and give him a couple more years out of it.
Thank you. It wouldn't have been good without the little swirly dot at the end of it. So I know we're because we could go on for 3 days, I'm sure, but I did want to mention this one because another thing that you talk about in your senior presentation that I just thought was really, it was mind-blowing for me, and I've been around it for a long time. But let's talk a little bit about dementia. Let's talk about, because I am thoroughly guilty of this. When I start seeing symptoms that could be, I assume that's what it is. And of course, then you go through a little bit of a freak out because that's one of those, you're getting old,
Yep.
And
that's it, put grandma in the
step.
home. That's it. We're done. She's going crazy.
Oh no! Now what are we gonna do? Right. But it's not always dementia.
No.
Can you go through some of the things that folks should be looking for before they make that call?
Right. So it's always important. And I know it's actually kind of funny because, that's what everybody thinks immediately. This is the reason why your veterinarians want your cats to come in when they start becoming seniors, to at least see the veterinarian twice a year so we can start catching any progressive diseases early. So when you start noticing your cat is, I don't know, eating a lot of food, but still like really thin or losing weight, or my cat's now howling in the middle of the night, my cat's acting lost, my cat's acting like it can't hear me, you might go to the vet and be like, oh, I guess it's dementia. A very good veterinarian will be like, you know what? I think we need to run a full metabolic panel and a full exam and find out if there's something biologically and metabolically wrong with your cat that's causing these symptoms of dementia. Because believe it or not, high blood pressure, kidney disease, hyperthyroidism, all of those have very similar symptoms of dementia. I mean, you have to rule all of those out before you can say, yes, there is some sort of cognitive dysfunction going on with that animal. Now, a lot of times these cats tend to have high blood pressure, and that's usually one of the number one reasons why we're starting to see symptoms of dementia. When they howl at night, they act lost, they're spacey. A lot of it is due to high blood pressure. And it's really important to advocate that when you go in for that senior exam, you're not just doing an exam and blood work. You want to make sure that cat's having its blood pressure taken every 6 months. I personally like to see senior cats come in more than twice a year. When I've had my seniors, I'm not a veterinarian, but as a technician for over 26 years, I think it should be 4 times a year. Can it be, financially feasible for most people? Probably not. But when you have animals that are starting to have changes, the more you keep on top of those changes, the sooner we can start treating the changes. And sometimes 6 months is too long for many of these changes.
Can I ask you something in terms of the senior wellness test and test panel? Is T4, is thyroid usually included in that? Or do you have to actually say, I'd like you to check thyroid levels?
It depends upon the blood package that the veterinarian will have. A senior cat, most veterinary offices will have that thyroid panel included in it. If you are unsure, ask what's in the blood panel, because most vets will be like, we're just going to run your senior lab work. That's nice. What's included in that senior lab work? I want to make sure that my cat has everything so I don't have to bring it back in and stress it out for more lab work. So we want to make sure we know what we're looking at on your cat metabolically. Now, sometimes the T4 might not be enough. Sometimes if we notice an elevation or a gray line number, we might have to actually run additional panels to be like, is it really thyroid disease? Is it really kidney disease? Like, what's going on here? So that's why your vet is always like, we need full bloods and we need urine and we need this and we need this. And it sounds like a lot, but that's what paints the broader picture for this species that don't like to tell you that they're ill.
Yep. And for any of you guys who, if you've never dealt with hyperthyroidism in cats, which honestly, I don't know if it's just me and just because I've been around for too long, but it feels like hyperthyroidism is more prevalent than it was back in the day. And the same goes for diabetes. And I don't know what that, I mean, diabetes is obviously because of obesity too, but is that true? Do you notice more hyperthyroidism?
We're noticing it more, and there's probably two factors to this. Number one, feline medicine has gotten a lot better in the past 26 years that I've been in medicine, so we're paying attention more. Number two, there has actually been discussions of, is it all the flame retardants and smoking, et cetera, that these cats are exposed to in the home? Because you have to remember that, we're up and about, we're much higher than they are. And they're right on top of these fabrics that have flame retardants. They're on top of all of these carpets that have fumes in them, et cetera. Are they being exposed to it at a different rate than we are? What are causing these underlying diseases? But a lot of it, I think it has to do because we're actually paying better attention. Yeah,
that's a fantastic point. If you don't know what hyperthyroidism looks like, and if you've never seen it in your cats, one of my oldest friends who's a vet, she said to me, it's like being on an IV caffeine drip.
Yeah.
And it's just, you are always just sort of going and you're eating, but your body is still just metabolically like just consuming. You're always in this state of moving. And that's, again, when we might see with seniors that excess vocalization, which we would normally, because I said I'm guilty of it, chalk it down to dementia before going into that place,
Right. And it could be just even simple, age-related changes, such as, nuclear sclerosis, when their eyes just start to cloud over a little bit, and it's not cataracts, it's normal aging for their eyes. Their other senses are going to go down as well. Like as you get older, you get a little hard of hearing. You might not smell as good. Food might not taste as better. So these are all like these changes that we need to make for our feline friends. Like maybe they need a nightlight. Maybe they need to have their food heated up. Maybe we need to change to a different diet to make it more palatable as well. Maybe we need to not just do, just talking to your cat, but maybe other cues of like clapping your hands or waving your hands in front of them, just so they can acknowledge that you're present. So you just need to make these other subtle changes for them versus saying, my cat has dementia. Maybe it's just age-related changes as well, and we're not noticing it.
And that's the key, is noticing. And the way you notice is you get ahead of the curve just a teeny bit, right? Don't forget, these changes happen fast, whether it's visual, whether it's scent related, whether it's hearing. If you notice that your cat is just responding slowly, something as simple as standing behind them and doing the old snap test or clap test, because you should see the ears just do a little bit of that thing, that little radar dish, right? And if you're not seeing that, it's like I said, it's incredible how fast it can happen in cats, and that just the deafness in itself leads to more vocalization. The fact that they're not seeing in the dark as well as they used to, which is what happens. The light goes out. Hold on a second. All of the tools that have kept me vital all these years and alive are and the panic sets in.
Your sun is dimming.
And it's just really interesting. It really is that I think that things like dementia, when coming back to what we said before, it then becomes more about us and our panic and our dread and our sense of, oh, my cat is mortal and he's going to go someday. I get it. It makes sense. But in terms of promoting vitality, we got to push that aside. We have to push it aside. have to.
Right. I think you need to realize that they live their own lifespan, not our lifespan. And I think once you accept that fact, I think it makes you appreciate your pet a lot more.
Yeah. Now let's talk about, again, I'm going to try to stay as brief as I can, but we talked about vitality through arthritis. So vitality through loss of acuity or things like dementia. You mentioned something like a nightlight, but are there other things that you would do, and whether this is from a clinical standpoint or just a home sort of proactivity standpoint, for cats that are going through that?
Bring a lot of the things to them, especially if you're having cats that can't seem to find the litter box. A lot of people with these cats that have these comorbidities or cognitive dysfunction, they think their cat is vindictive or it's, urinating or defecating out of the box because they just want to. It's not because of that. Maybe they're having a hard time finding it. So if you have your cat's station where it likes to lay down in all the time and have the food and potty box not on top of each other, but within the same vicinity. So there's not a lot of searching that needs to be done. It makes life a lot easier, especially for these cats that are so thin and or so obese they can't even move anywhere, that they actually need that extra, step to get their items to them. So they're not making these mistakes that we, would be like, my cat pooped underneath the dining room table. Now something's wrong with it. My cat's mad at me. I pulled a vacuum cleaner out and it pooped under the rug. Well, maybe your cat just can't squat in the box anymore. Maybe it's had to go to the bathroom so bad that it couldn't even make it. And that was the easiest spot. And it felt good to just go there at that point in time. So bringing items to them sometimes can make a big difference.
And it's so funny you mentioned this, and it's just I feel like I've got the past to talk about this, from the Jewish world or from the Italian world. Food is love, man.
Yeah.
Food is love, and we feed the hell out of our families.
And those obese cats are a huge problem.
It's a problem.
Everybody thinks they're cute. It is a major problem, and we are actually causing more medical problems with these animals by not keeping them at a lean body weight.
Exactly. Love is love, you guys. Enrichment is love. Food, not necessarily, and it doesn't mean just because you feel sorry for them that you should feed more, It's just, again, and a lot of this, because I just want to make sure that I'm hitting everything. There's, like I said, we could talk all day, but it really does come back to, if you want your seniors to retain their vitality, to keep searching out new things, which is possible. We can be however old and look for new exciting things in our life and not just settle in. It really comes down to you as their person, not letting that dread or not letting that fear or not letting anything stop that relationship from staying vital. The relationship has to stay vital in order for the cat to stay vital. And I think that's, and I think that by and large, the world of veterinary care has come so far. We were just touching on this before, come so far in terms of it not just being about, I call, my cat's peeing on the carpet, bring the cat in. That there is so much more support, I feel.
Yeah.
And a lot of that has to do with people like you on the front line of all the, can you talk just really briefly about what you've done? I mean, I know that you've worked on protocols for senior cats. Can you just talk about that just briefly so that everybody knows?
I regularly lecture on the veterinary front. I do have my lecture on, senior cats, enhancing their golden years, basically. And a lot of it is like, when you discuss it, even to your colleagues, some of them are like, I never thought of that. They're so into the moment of it. It's all about medicine, and it's not about the broader picture of the animal. So when you break it down into simpler and more connective terms, I think you have a better opportunity for people to comply, to actually want to do things. So a lot of my format is to if I'm not going to do it, I'm not going to teach you, or I'm not going to preach to you about it, because I firmly believe, as an educator, that you need to practice what you preach. So my goal is to always give practical and useful information, even in clinical practice, that you can bring to your clients that are actually going to be useful to them. Because you can lecture to a client all day long about, you need to do this, or this. And if you make it impossible for them to do, well, they're not going to go ahead and do it. And so I enjoy, teaching in that aspect of working with the feline patient down into very easy terms that you're going to want to use and you're going to want to share with your clients.
One thing, and we're not to bunch this down to the very end, but we've got like a minute here. Mm-hmm. But if you had to give everyone out there one piece of Ellen wisdom to bring into the veterinary care of their cat moving forward, what would that be?
Advocate for your pet. Don't be afraid to have serious discussions with your veterinarian, even if it's the smallest concern. You do not need permission from your veterinarian to have your cat seen. If you feel that there's a problem, they should be seen immediately. You have a legitimate concern. Maybe you're the one that can tell us more about the changes in your cat, and we really should be listening to you. But just because we say 2 years, that's just a recommendation. If you want to come in more, we're more than happy to see you. We want to make sure that we're actually going to be able to enhance your cat's life through many, many years. And if we have to see you sooner rather than later, we much would prefer that. Advocate, and you don't need permission.
There you have it, people. There you have it. Words of wisdom. Ellen, thank you so much for helping us take it through the senior years here. And again, you were around for the kittens this morning. You were around for the seniors today. Ellen, the know-it-all. And I'm so stoked that you were here with us today and bringing everything you have. So again, thank you, and we'll see you soon.
Thanks for having me. Bye, guys.